My name's Lindsey Winfield, and I'm a family nurse practitioner with U of L Health. I have known for a really long time that I wanted to do medicine. My mother, when I was really young, was sick for nearly a year before she was actually diagnosed with lupus, and I took care of her by her bedside all the time, and I knew then that it was my calling and that I loved it so much and that I wanted to spend my life doing it. I work at U of L Primary Care Associates in Buchel, and I'm a family medicine nurse practitioner. So I see patients from 12 through geriatrics, and we see patients all across the board. We see a lot of chronic illnesses, so I manage a lot of diabetes, high blood pressure, high cholesterol. I do pulmonary care, so we manage asthma, COPD, and then we also do a lot of mental health, so anxiety and depression as well. I think that one of the things that I kind of do differently is I really get to know my patients. I spend a lot of time with them. My patients and I are all very close. We share personal stories. I know their family members. I see a lot of, patients and their children and their parents and everybody kind of across the spectrum. We, get to know each other on a personal level, and I think that helps with them getting to know me and their, confidence in me as a provider. I like to spend a lot of time with my patients and make sure that we're all on the same page with their healthcare goals and my goals for them. I like my patients to kind of help me drive their care. Initially when I see a patient, I like to get a really thorough history. I like to know what they do for work. I like to know, what their family status is. And I like to know what their health goals are, what they want for themselves, what they think is realistic for them. And then from there, we kind of come up with a plan together, taking into consideration, socioeconomic class, any barriers that we might find in their healthcare. And we like to tackle those together. And I like to be really hands-on with my patients. I like to be really accessible. So I like them to be able to reach out to me. I always tell my patients, call me whenever you need anything. And I like to reach back out to them after I see them and always make sure that we follow up. And we try to do in same-day appointments as much as possible, just to make it super accessible for them. I have a 15-month-old daughter and a chocolate lab that I share with my husband. We've been married for 3 years. We really enjoy the outdoors, so we like to do anything from hiking. We go to the lake a lot in the summers. Anything like that, anything that can get us outside and moving is definitely a passion for us.